Hello, everyone, and welcome to the GTR East Africa virtual event, version 2021. I guess it would be unreasonable for me to start in any other way than to wishing that this is the last time we do it virtually. I'm personally very keen to see all my dearest friends in East Africa live. So hopefully we'll be back perhaps in Nairobi next year and do this face to face. For those of you who don't know me, my name is Duarte Pedreira. I head up emerging and frontier market financial institutions and trade finance for Crown Agents Bank, a London-based institution. And I'm also a board member of the global trade finance industry body, the ITFA, where I have the absolute pleasure of leading the ITFA's initiatives in Africa, and as well with on the area of emerging leaders, so the next generation of trade financiers. Today, we will be discussing what we hope will become a topic of hope. COVID, but we will give it a bit of a different twist. We want this discussion to be as forward-looking as possible, focusing on solutions around vaccinating Africa, and also how we adapt to what we want to become the new old normal, where we can all be, as I said, face to face and interacting directly with one another. There's still quite a bit of a track to go through for us to get to that new old normality, but hopefully with the help of my fellow panelists, we will provide you some encouraging news and opinions about how to achieve that. So today I'm joined by four very distinguished friends and colleagues from a myriad of different backgrounds, in no particular order except alphabetical. David Pitts, who is a dear colleague from Crown Agents Bank, and David's role in this panel will be to capitalize in his many years of experience as a banker leading the way for the development sector. We also have my dear friend Grace Murage from RMB. She is the regional head for RMB in East and Southern Africa. She will bring the flavor of the sort of the local banking system. We are also joined by Yelena Madir from Gavi. I think Gavi at this stage is fairly well known. They are the Global Alliance for Vaccination, and they're helping us all with the COVAX program and many other initiatives. So Yelena will kindly help us from that particular angle. And last but absolutely not least, Will Garton-Jones from Paycode, FinTech. Will give us the technology background for our way out of this pandemic. But without any further ado, I'll ask each one of them to perhaps in very short period to introduce themselves, again following the same order. David Pitts, Grace, Yelena, and Will. Please, the floor is yours. David Pitts.
Thanks, Duarte. So as Duarte says, my name is David Pitts. I've been with Crown Agents Bank for 3 years, and previous to that, I was with Echo Bank for 7 years, and prior to that, Standard Bank of South Africa for many years. I've been 20 years in the development world, so you've seen a lot of change in that time, and obviously the last year has been, one of the most challenging. My role is to head up a team that looks after the relationships with the international donors, United Nations agencies, the international NGOs, and some foundations, as well as some for-profits that are working in the development space. We build partnerships. We also build partnerships with fintechs that are operating in the development world. My good colleague Will is on the joining the panel today from Paycode, and that we like to sort of work with fintechs that can make use of CAB's digital payment capabilities. The key for us is that CAB over the last year or two has become more of a fintech as well as a bank provider. And this follows our acquisition of Segovia Technology in 2019, which is a fintech aggregator that can make mobile payments in multiple countries, and many of those are in East Africa. So that's it for me for the moment, Duarte. I think that covers things.
Thank you very much, David. Grace, the floor is yours.
Thanks, Duarte. My name is Grace Murage, and greetings from Nairobi. As Duarte mentioned, it's a pity that we have to do this virtually. To have been really great to meet everybody at, I guess, what would have been at the Radisson. But nonetheless, we work with the situation as is. I am part of the RMB team based in East Africa, based in Kenya, and I look after the banks and DFIs in East and Southern Africa. So in my role, a coverage role, I engage with banks and DFIs in coming up with funding solutions and also looking at just the transactional value chain in terms of supporting them in their day-to-day occurrences. I'm very happy to be part of this panel and looking forward to a very intriguing and forward-looking discussion on what is a very pertinent issue around the impact of COVID-19. Thanks, Duarte.
Thank you very much, Grace. Yelena, your turn.
Hi, my name is Yelena Medir. I'm the General Counsel of Gavi, the Vaccine Alliance. Gavi is a public-private global health partnership whose underlying goal is to increase access to immunization in poor countries. It is set up as a foundation with privileges and immunities of an international organization in Switzerland. We also have an office in Washington, D.C., and a UK-based subsidiary that issues vaccine bonds. And from the governance perspective, given that we are a public-private partnership, our board consists of representatives from developing countries, developed countries, WHO, UNICEF, the World Bank, the Gates Foundation, vaccine manufacturers from both developed and developing countries, and civil society representatives. And the reason I think it's important to flag this at the outset is that I think it's precisely this model of a partnership that has allowed us to be flexible and achieve scale at the time of the pandemic.
Thank you very much, Yelena. Will Garton-Jones.
Thanks, Darcy. I'm Will Garton-Jones. I'm the Business Development Director and an early shareholder in Paycode. Paycode is essentially a biometrically driven payment system designed for rural and urban populations, specifically designed for an African environment and all that that implies. And it's got a powerful data capability, which is particularly useful in the context of things like vaccine distribution. And I spent 30 years in the technology industry, which is my background. And when I first came across the technology, I was really, really impressed and decided I was going to help drive it forwards.
Thank you very much, Will. Let's get into the discussion. So I broke down the conversation into three main topics, but of course, this is a panel, so we'll try to keep it as fluid as possible. First topic, of course, it's unavoidable. We need to talk a little bit about how do we got here, and eventually setting the scene for what I personally consider are the two most interesting parts of this conversation, which will be around vaccinating Africa and how we move back into that new old normal. So that means kind of what we had before, but with all the improvements and lessons learned from our joint fighting of this pandemic. But let's take a bit of stock first. David Pitts, I'll start with you. It's unquestionable that the development world and a number of players in the development world played an absolutely pivotal role in making sure that eventually that things didn't become an absolute disaster, particularly around emerging and frontier countries. What's your view on that? How was that response from the development world?
Well, thanks, Duart. I think the first thing which is quite worrying at the current time is that it's about the international donors. Because if you look at the international donors, I mean, take our own country, we're in the UK. So if you look at the UK, historically, you know, we've actually had 0.7% of GDP has been destined for a sort of ODA flows. Well, that, of course, has been temporarily cut back to 0.5%. But that's 0.5% in terms of an economy that has significantly shrunk. So, you know, we can actually see the sort of double whammy effect of this. And, you know, we can see now that whereas, you know, a year or two ago, it was $15 billion of aid a year that was being provided by the UK, that's now down at 10 billion for sort of 2020 and 21. And my worry on that side is that the sort of programs have typically 2 to 3 year commitments. And I think the next 5 years is going to be we're going to still be suffering the impact from this. And of course, the international aid is so important when it comes to, you know, the support they provide to the NGOs, the charities, and even to the likes of Africa Development Bank and the development banks in general, who rely heavily on sort of Western governments for their support to carry on their more focused regional and country work. But let's come, you know, to come back to the sort of NGOs for a moment. I mean, we have within the bank, we have a portfolio of about 80 that we look after. And when you look across the portfolio, you know, we were sort of beginning to ask them, well, how are you going to carry on running, and sort of what's the impact on you? And there were a couple of things that they would always talk about. First of all, it's the programs. How do the programs, you know, in the emerging markets, in places like in East Africa, how do they keep going? And the second thing, of course, which is vital, is how do you fund those programs? So, you know, those are the two things that we could consistently ask all of our NGOs. And in terms of the programs, I mean, there's no rocket science. I mean, they had to learn very quickly. They had to sort of think straight away about staff safety and well-being, and that was obviously the prime concern. A lot of the foreign staff were sort of called back home, and they had to sort of make it on the last planes out from many of these places. And that brought, of course, a sort of remote sort of management challenges for these programs. The programs then, you know, a lot of was down to basics, so it was re-emphasis on things like hygiene, washing hands, social distancing. But what it did make the NGOs think about was the need for greater automation, because I think sometimes you need an event like this to sort of force change. And, you know, of course, a number of the NGOs were ready to make that change. They've been thinking about it for some time, but not all of them. And we found sort of mixed reaction on that. And of course, they've adapted their programs. You know, some of the programs that were allocated for other developmental activity became more emergency response, you know, for COVID. So, and we've had some which have actually done very well out of this. And I say done very well, what I mean is that they've been able to use their skill sets more effectively. So water aid would be an obvious example with sort of the hand washing and so on. But generally speaking, they've had to reallocate funding from one project to another, and that's how they've survived. On the funding side, the international NGOs, they do tend to have emergency funding. They have funds kept back. Their programs are geared for sort of 2 to 3 years. They have a depth of liquidity, quite a lot of them. So they've been able to make savings. They put some staff on furlough schemes, etc., and they've got other support from governments as well. But those that have got retail operations, you know, where they've relied on funding which has been raised through their shops and so on, we have several of those in the UK. They've struggled more, you know, because obviously the shops have been closed. So I think generally the NGOs have come through quite well. I do think, though, that the local NGOs have suffered more because they obviously in turn depend upon their, you know, a lot of the sort of NGOs and the donor support from abroad. So some of the civil society organizations certainly have been struggling within the countries. We're aware of that.
Thank you, David. And Grace, I think the banking sector was really hardly hit as well. I mean, we not only the lockdown situation forcing local players and international players, there weren't any exceptions, into remote working. But at the same time, this all came crunching down as such, with significant restrictions around available capital, lending, and so on and so forth. What's your view? How well did banks respond?
Thanks, Stuart. I think that's it's a very heavy question. Just looking at how the economies of East Africa were impacted by COVID, we're lucky that none of us have gone into recession, but definitely the growth trajectory has been almost halved, if not more. And we're seeing the main sectors that have been affected from COVID. And I know this is, public information. It's really your hospitality, your infrastructure, your aviation and transport sectors. And banks are really at the center of funding these sectors. And just looking at the NDR results that have been released by many of the banks in Kenya and across the region, the earnings have been impacted quite heavily. And this is stemming from the additional provisions that the banks had to take out on their existing credit facilities. We saw a number of moratoriums or credit relief measures that were rolled out across the region, stemming from the central banks and also cascading down to the banks themselves. And we're seeing that asset quality is really an issue or something to look out for the banking sector, not just now, but also going forward. We've seen some muted credit extension, especially in the last year, especially owing from the various lockdown measures and containment measures that were put in place by the government. However, I think looking forward and into 2021, just looking at one of the private sector credit report that the Central Bank of Kenya issued in just recently, covering the Q1 of 2021, we are seeing some offshoots. We are seeing some positive notes there. We are seeing some uptick in terms of credit extension. I think the credit growth year to year compared between March 2021 and March 2020 was about 6.8% up. So I think there's some optimism coming in. But very muted, very cautious, because as we know, this COVID pandemic is not going away. We're going to have waves of lockdowns and then waves of ease of movement. So it's start and go, and it's impacting various economies very differently. So I think looking at the banking sector, asset quality and more stringent extension of credit facilities is going to be the flavor of the day. We are also seeing a lot of capital preservation. Banks are not paying out dividends. They are preserving or holding on to the liquidity and the capital that they have. So those are just some of the things that we're seeing across the sector in East Africa.
Thank you very much, Grace. And Will, from your point of view, of course, technology has become, it was already very important and a huge part of the conversation across the board, particularly around the role that fintechs are playing. But technology really became everything. But look at us. We are having a panel discussion around the screen. How do you think Africa fared from a technological point of view and trying to use technology to eventually continue trading and continue the growth path, perhaps versus the rest of the world?
Well, I think that modern technology has proved critical in enabling the world to carry on moving, and Africa is no different. And to a significant extent, things like Zoom and Teams and Google Meet and all these new systems that weren't widely known before the pandemic, which have become widely used in the developed world, become equally widely used in Africa and very useful. Take Paycode, it's a highly distributed business from a geographical point of view. We're all over the place. Without these tools, we find it much harder to operate. And in fact, we've, as a company, have derived very direct benefit from the availability of tools like this. So to some extent, and for some activities, Africa has used the same new technologies as everybody else. But there are some very particular difficulties in an African environment when you're deploying technology of the sort required to support a vaccine rollout, for example. The principal challenges then you get are things like identity, connectivity, and cost. The cost to serve is always critical. You know, you're dealing with very poor populations. It can't be priced at anything like you get in the developed world. And you have to use a technology that can scale in order to be able to keep that cost to serve at the individual level down. And large swathes of Africa still don't have any connectivity. And even where connectivity does exist, people can very often not actually afford or don't want to buy the data or the smartphones that are implied by the use of some of the more sophisticated services. So the technology has to adapt in order to deliver the benefits for this particular environment, particularly to the more remote areas. So it means it has to be able to work absolutely properly whether connectivity exists or not. And finally, many technology, when you're looking at technology solutions for the health and the financial services sector, such as vaccine rollout, having a secure identity is absolutely crucial, a unique and secure identity that's guaranteed not to be duplicated. And large numbers of people in Africa actually don't have this as a matter of course. So for these services, of which vaccine delivery is most definitely one, a unique identity is essential, and the technology must also be able to deliver that. So with the vaccine, the pandemic has obviously driven the looking at this sort of thing in order to be able to do it, and that's quite exciting. So you're seeing African solutions for Africa and the developed world making headway as a result of COVID.
In effect, accelerating the future a little bit.
Absolutely.
Jelena, turning to you, I mean, I can't help to resist or not to resist the question as such. When you joined Gavi, perhaps prior to the pandemic, maybe you wouldn't imagine that you would be at the forefront of such an important initiative so quickly. But I'm pretty sure it didn't come without its challenges. So what have been the main challenges that Gavi has faced throughout this pandemic, and perhaps help us understand a little bit more the important work that you guys are doing?
Sure. So Gavi has been tasked with setting up and managing the COVAX facility, which is essentially a global risk-sharing mechanism for pooled procurement and equitable distribution of COVID-19 vaccines. This is a project of huge scale, enormous complexity, and significant legal risks. It includes agreements with over 100 governments, guarantees from a number of countries and commercial banks, advanced purchase agreements with a number of pharma companies, vaccine manufacturers, and a range of financing agreements with a number of multilateral development banks. COVAX is also very different from Gavi's business as usual model because it covers not only low-income countries, but also a large number of self-financing countries in the upper middle income and high-income brackets. And many of these countries are Gavi's longstanding donors and are represented on Gavi's board, but we've had to negotiate with them as with any commercial partner, and this required a significant shift in the mindset. COVAX represents quite an innovative model, which I believe could be looked at in the future for other initiatives. It's innovative in a sense that, as I said, it caters to both high-income and upper middle-income countries, which are participating on the self-financing basis and are required to pay for their vaccine doses through COVAX. And then you have a group of 92 low-income and lower middle-income countries, which are entirely donor-funded, and many of which are in Africa. Other innovations of this initiative include the fact that we've also launched a mechanism through which countries can donate their surplus doses. And we've also created a humanitarian buffer whose objective is to cover populations that may not be covered through the main allocation mechanism for vaccines, such as refugees, internally displaced people, and asylum seekers. And also another innovative product under the COVAX facility is that together with WHO, Gavi has set up a no-fault compensation scheme for the 92 low-income and lower middle-income countries, as I said, many of which are in Africa. And through this snowfall compensation scheme, individuals from these countries will be able to claim compensation for serious side effects caused by COVID vaccines administered through COVAX without having to prove fault through lengthy court proceedings. And in fact, this is the first global vaccine injury compensation mechanism, which will be funded by a small levy on each dose supported by COVAX for those 92 countries. On a purely practical level, the intense work on COVAX has meant that we have had to reallocate resources to address urgent problems and be more rigorous in deciding on the work that's outsourced versus work which is handled internally or even postponed. And more than ever before, we've had to be adaptable, comfortable with risk, and business focused.
Thank you very much, Helena. And I guess that's the perfect way to close this first chapter of our discussion. And now we move on to the sort of more hope-led topics. Let's talk about vaccinating Africa. And Yelena, if you don't mind, I'll continue. I'll continue with you. Of course, you know, it's become a little bit of a recurrent expression that we're only as strong as our weakest link, as such. So how important is equitable access to vaccines to get us out of this crisis as such? And you know, we know some of the pointers that perhaps we would like Africa to be vaccinated up to a level of 20% of population this year. But again, this crisis will perdure for as long as so-called herd immunity is not achieved globally. What are your views?
So interestingly, the UN Economic and Social Council has stated that vaccines are a global public good and should not be treated as marketplace commodities available only to those countries and people who can afford to pay the asking price. At the same time, however, we are seeing some wealthy countries reportedly purchasing enough doses to vaccinate their entire populations multiple times over by the end of this year. And not only will this vaccine nationalism extend the duration of the pandemic, but it could also lead to many preventable deaths if vulnerable people in certain countries can access vaccines only after those at low risk in other countries have received them. And also the nature of the global economic system means that hoarding vaccines may lead to further losses in the global economy as a whole. Because as we are all aware, economies worldwide are closely interlinked, and a prolonged pandemic in low-income countries will inevitably cost high-income countries more than if they funded vaccine distribution in poorer nations. By contrast, fostering the multinational cooperation and coordination that is required to make vaccines available across the globe could indeed save money for everyone.
Agreed in full. I mean, it's about saving lives, number one, I guess, and also making sure that we accelerate time to delivery in terms of getting into this new old normal where we are all trading and socializing again. And David Pitts, turning to you, this all comes with significant challenges. I mean, I know for a fact I was fortunate enough to get my first shot last week, and I went into this vaccination center, and I was extremely impressed with the number of people, volunteers or not, that were there to organize the entire process. It worked seamlessly. But I guess all of this comes with a cost. I mean, here in the UK, and again, making perhaps the assumption that people there were getting paid, you know, you have different people taking you through the different steps. It's not just the person giving you the job. How does one create the necessary transactional financial infrastructure in Africa that goes beyond just the purchasing of the vaccines, but actually supporting this entire system?
Well, that's a very, very good question. And, you know, we're starting at such a low base with only about 2% of the population in Africa having been vaccinated, you know, so And I think, you know, everything Jelena says about COVAX is absolutely right. And it's a brilliant sort of scheme put together by the world. But of course, you know, that's only aiming at sort of 20% of vaccinate to 20% of people to be vaccinated in these 92 countries by the end of this year. So there's another 40% that's still required, because, you know, the general perception is that you need to reach 60% to reach herd immunity. And of course, that's important not just for the countries, but also for the world, you know. So I think there's there's many questions to be asked. So who is going to finance, you know, that extra 40%? And, you know, we look around and we see, yes, the World Bank, IMF and Gates Foundation and others are all, you know, offering support. But it is going to come down in many cases to the local governments and their own ability to fund, you know, the requirements, you know, beyond sort of COVAX. And when you look at that, you know, the fiscal constraints and, you know, inadequate planning in the case of a number of countries, it means that, you know, they would normally be looking for external financing. That external financing, the traditional bilateral, multilateral partners, that's perhaps not so readily available at the current time. So it comes back to the countries, and I think we're going to see a lot of reallocation of other sort of program funds, you know, funds that were, as I said earlier, funds that were available for development now being used in short term for emergencies and, you know, to actually find solutions. But we've actually sort of also thought about what can the private sector do? What can the private sector do to help? You know, because, you know, we have certain skill sets that really, you know, should be capable of being brought into play. And we actually, this is where we began with our sort of partnership with PayCode. And we said to ourselves, well, we think that, you know, we should concentrate on the things that we're good at. And in our case, it's actually moving money, and it's moving money to the right places, and it's paying the right people. And we thought, well, let's start off by thinking, you know, through our mobile money capabilities in a number of countries, can we actually sort of pay the healthcare workers? You know, it's the healthcare workers that, you know, first and foremost, we should be looking after. You have to remember, of course, that with this crisis, nobody wanted to be a healthcare worker, particularly to begin with. They were very brave, the people who were, you know, but they were the ones who were getting ill. So, you know, of course, as soon as you've got a vaccination program, you know, far more people want to be healthcare workers. But you need to actually control that, and you need to sort of be able to register, and you need to understand who are the healthcare workers. And this is where the logistics comes into play, because you mustn't never underestimate the logistics. And Jelena mentioned that as well. You know, the planning and the coordination, the ability to deliver coherently and in the right order, you know, because you must have the training and the cold stores in place before you import the vaccines, you know, otherwise it just isn't going to work. So what did we do? We actually sort of said, let's actually research the different countries where we operate. Let's see where we can actually, you know, make a difference. And then let's start talking to the local partners, the technical assistance partners, people like WHO, people like UNICEF, and also, of course, the ministries of health in these countries. And we said, let's sort of work in conjunction with PayCode's logistical support, you know, around the ID and, you know, being able to cover the non-coverage areas and thinking about cards and biometrics and so on. And we knew that a lot of studies have been done about the benefits of paying these healthcare workers, because the Gates Foundation, if you go on their sites, you'll find lots of reports about the benefits of paying healthcare workers. And this can be whether payments make sure that people attend on time. You know, the certainty of payment, it adds to the efficiency. You know, mobile can go where banks cannot reach, you know, i.e. in the rural locations and so on. It ties in with other digital services. So thinking about how they record patient records. So you have very, very good sort of apps these days. It also benefits, you know, the healthcare sector beneficiaries. And I'm sure Will mention a little bit about that in a moment, about it's not just about paying healthcare workers. Beyond that, the work that PayCode does on logistics, it makes sure that you can keep accurate records for all the patients and so on. And digital solutions do work better in emergencies. You know, it's when you get an emergency, the digital solutions and the ability to make payments, it just means that instead of weeks, you know, you can bring the time span down to just days. And digital payments improves performance, attendance, and also retention of these healthcare workers. So finally on this, we made proposals to WHO and to the governments in Malawi, in Uganda, in Nigeria. we're waiting on the responses. There are some challenges because we are disrupting existing arrangements, and that can sometimes be difficult. So we'll see on the responses, but certainly CAB and PayCode, we certainly want to be making our joint contribution as partners. Thank you.
Thank you very much, David. And straight on to Will. Of course, your solution couldn't come at a better time because, again, as I've alluded to, and David as well, there are significant logistical issues, and there's no time. Tell us a little bit more about that, Will. How is PayCode actually making a difference in this area?
Okay, thanks, Duarte. I'm going to dive a little bit into the tail end of what David was talking about. How we actually do get the last mile sorted out from a payments, finance, and data perspective. And it's that combination of a payment system that's designed for this particular environment, combined with the data capability to allow us to track health records and vaccines and stock and stuff like that. So I probably need to describe a little bit more about what PayCode does and how it does it. So essentially, somebody wants to provide funds which distribution is required. So typically that's probably government enterprise of some sort, banks, insurance companies and things, agricultural companies, NGOs and DFIs. Those are the typical sort of funds distributors. And the money would be put into trust accounts in one or more commercial banks in the countries in which the distribution is required. And then, and only then, e-money is created in our system, which matches to the cent the money, in the real money in the accounts. And that e-money is then distributed electronically to known identified living people, to wallets that they possess. And then transactions are performed on or offline where they spend the money, and that spending can be controlled, so you can control the way in which the funds are spent. And then there's a settlement process behind the scenes to ensure that the e-money and the real money match to the cent in that cycle, and that settlement happens within the banks and between the banks that you're using. And this is all backed up by detailed reporting showing who got what, where, when, and potentially what they spent it on as well, if that's a requirement. So what PayCode does is address those three challenges identified. Identity, because every single transaction is biometrically authenticated, so you know who's done it. Connectivity, because it works completely offline as well as online, so you can load and spend in the most remote rural areas without data connectivity, and without credit risk as well. And cost, it can operate at a huge scale, so it brings the cost down, right down at an individual level to a cost that can make sense in the context of the incomes of the people we're talking about. So as David was saying, we're working with Crown Agents Bank, specifically in those three countries, Malawi, Uganda, and Nigeria, designing this implementation specifically for vaccine distribution. And the sort of functions that we're able to cover with the system include things like tracking and tracing the vaccine delivery and stock, tracking and recording the vaccinations as they happen, paying the healthcare workers, dispensing medicines, and we can also do a range of other services using the same system, things like nutritional food distribution and sale, input grants and yield payments for agriculture, relief grants, remittances, microloans and insurance. That's all done as the basic PayCode service. But the most important thing here is all of this can survive the vaccine rollout and form the basis of a long-term financial infrastructure supporting Africa's diverse population. So out of this disaster that's COVID, you create the footprint going forward for a completely new infrastructure that really can help these populations thrive and prosper.
Thank you very much, Will. And again, it's about facilitating this rollout, and I'll be very keen to discuss this with you on how we can eventually get the benefit of these technologies to definitely and structurally improve the way we do things in the continent. But let's save that to that more hopeful last part of the conversation. Grace, turning to you, I mean, the local, local and regional, of course, banking sector, as you mentioned, has been facing some significant challenges, and now all of a sudden, we really require people to get together and create transactional and funding infrastructure for the vaccine rollout. How well prepared do you think regional financial institutions are for this?
Thanks, Stuart. It's a good question and an important one at that. How well prepared are we? I think we are coming to grips with it and coming to grips with the requirement at hand. And what is that requirement? Is that banks need to step up and bridge the gap between the public sector and the private sector. So we saw at the onset of the pandemic, banks were very quick to rally behind the healthcare sector, providing the PPEs, the medical equipment required. For instance, at RMB, we set up the Spire Fund in South Africa, and we rolled it out through our subsidiaries. And through this fund, we not only raised funding to be able to procure this medical equipment, but it also acted as a think tank in terms of supporting the governments in terms of, coming up with the modalities around bolstering their healthcare systems. At RMB, we actually came up with a procurement system for the fund or the farm to actually procure the medical equipment and the PPEs themselves. And what we were able to do was to also white label it to the government of South Africa. And through that platform, they are able to procure the equipment that they need from that platform. So going forward into the vaccine rollout, we are also talking to the Solidarity Fund in South Africa, and we hope to be able to provide such advisory services to other governments in Africa on how to roll out the vaccine programs. As David mentioned, Africa is sadly lagging behind the vaccination trend. We, I think, only 1.5% of the total global population that has been vaccinated. And I think what is also more concerning for me is just how we are using the vaccines that we've been able to procure. So I think only 50 or 60% of what we have in stock has been rolled out. So that provides a great opportunity for banks to step in and help governments to come up with the actual rollout mechanisms, whether it's through funding mass vaccination sites. We talked about, remote areas across Africa not being able to be reached. So these are some of the things that banks should be able to look at and are looking at in terms of setting up those vaccination centers. The other point that, is a little bit of a touchy subject, but I'm glad some of the heads of states of government in Africa, such as Rwanda and Ghana, they're looking at how can we as Africa produce these vaccines ourselves. We saw in the US, the FDA just recently lifting or temporarily lifting the patent, around vaccines, and that presents an opportunity for Africa to actually set up the manufacturing plants locally and start producing the vaccines here instead of waiting for other governments or other countries to be able to supply that to us. So I think there are areas that present opportunities for banks to step up. And what we need to do is not think the traditional, funding mechanisms of commercial loans. I think at RMB, we're also looking at sustainability bonds that we can be able to work with the DFI, such as Afrexim and TDB, in terms of helping governments to raise funding for the procurement of these vaccines. So in summary, I think two things that, or two roles that banks can play in is actually the actual procurement of the vaccines, the financing of that, and then two, in terms of rolling out the infrastructure and the mechanism to ensure that we get the herd immunity that we need to be able to move our economies forward.
Thank you so much, Grace. And I think you touched upon a really important point there, which is Africa production of vaccines. And that really links with that message of hope, which in fairness, it is only a continuation of the message that we were discussing and divulging pre-COVID. I mean, pre-COVID, we got to a stage where certainly perhaps the last 2-3 panels that I had the pleasure of moderating within GTR East Africa were very focused on African solutions for Africa. So moving on to that perhaps final and most encouraging side of our or stage of our discussion, how to create this new old normal. And what I mean by that is perhaps an improved version of the old normal on the back of all the lessons that we've learned. And Grace, carrying on with you, if you don't mind, is this time for us to go back to all those hope-filled conversations about intra-Africa trade, African solutions to fight the trade finance gap, the wonderful initiatives that local and regional banks were putting into place before the pandemic? What are your views?
Absolutely. I think this is the time for Africa for Africa. I think we've been talking about this for long, but now, you know, we need to actually actualize some of these discussions that we've been having. It's encouraging to see the AfCFTA agreement that was ratified in December 2020. I think 54 of the 55 countries in the AU have signed up for it. 35 of those have actually ratified the agreement and are in the process of implementing just the actualization of that agreement. I saw somewhere in the news that we did our first shipment. I think there have been 2 shipments actually within the continent in January. I think one was through Ethiopian Airlines, shipping some goods between Eswatini and Ghana, and I think another shipment that also happened within that time. So I think the agreements, the mechanisms are there. It's sad that there's a slow adoption to it, but it's understandable given the various governments that have to, you know, discuss it and have to come up with the implementation mechanism thereof. But I think it's a step in the right direction. It's a shot in the arm for Africa. And so the question, I guess, that comes to mind is, as we are waiting for this agreement to be adopted and the countries to come on board, what can we do? I think we have already, you know, regional blocks within the continent that are in effect, and we can continue to utilize them. We have the East African Community. We are just off the back of a very fruitful and promising head of state visit from the new president of Tanzania to Kenya. And we expect a lot of the issues or the frictional issues at the borders between Kenya and Tanzania to be reviewed post that visit. We have the SADC region that actually works pretty well. We have the West Africa Economic Zone as well. So I think what we can do in the meantime, as we're waiting for the AU agreement to come into force, is to continue to support trade within these regional blocks. I think as banks, we need to support SMEs and companies that are sourcing across Africa and within Africa, and to actually bring about those linkages between the countries that have the goods and the countries that have the value addition, or even actually equipping the countries to provide that much needed value addition. We saw, for instance, Ghana came out recently very strongly saying, you know, they're going to actually not export their cocoa, and they're going to value add it within their own borders. So I think those are some of the things that that we can expect to see in the coming months, and we hope, you know, in the interim, that banks will actually support, or we as banks need to actually support the trade that is happening within the borders of Africa.
I agree with you entirely, and what you've just mentioned about cocoa in Ghana is something that, for example, Rwanda has also been trying with